The explosion that breached Cabanat 1's main gate at 1945 hours sent Japanese guards scattering into the darkness. Corporal William Bennett, too weak from infection and malnutrition to stand, heard the gunfire and shouting, but couldn't process what was happening. After 2 years of imprisonment, sounds of combat simply meant more danger, more death, more reasons to stay hidden in his barracks and hope to be overlooked. Then an American voice cut through the chaos, shouting in English with an accent that sounded like a Hollywood movie. U.S. Army Rangers, we're here to get you out. Everyone who can walk, head to the main gate now. If you can't walk, stay put. We're coming for you. Bennett's mind struggled to accept the words. Americans? Here? The camp was 300 kilometers behind Japanese lines, surrounded by enemy forces. In terrain the Japanese controlled absolutely. A rescue mission was impossible. This had to be a fever dream, another hallucination brought on by the infected wound that was slowly killing him. But the American who burst through the barracks door looked absolutely real. Young, maybe 23 years old, wearing combat fatigues and carrying enough weapons to fight a small war. He swept the room with his rifle, then lowered it when he saw only skeletal British prisoners staring at him in shock. "I'm Sergeant Mike Callahan, 6th Ranger Battalion." The American announced quickly, "We got maybe 10 minutes before Japanese reinforcements arrive. Everyone who can walk, get moving now. Anyone who can't walk, sound off so we can carry you." "I can't walk," Bennett said weakly, his voice barely audible. He pointed to his leg, where the infected wound had swollen to twice its normal size. The bandage he'd fashioned from torn cloth was soaked through with pus and blood. "Infection? It's bad. Just leave me. I'm dead anyway." Callahan crossed the room in 3 strides and examined the wound with a flashlight. His expression tightened, but he didn't hesitate. "You're not dead, you're infected. We've got medics and doctors with the unit. You're getting out of here, and that leg is getting treated. Can you put your arm around my shoulders?" Bennett wanted to argue, wanted to explain that the wound was beyond treatment, that Japanese doctors had already declared hopeless, that any attempt to save him would just slow down the rescue. But Callahan wasn't waiting for debate. He hauled Bennett upright with surprising strength, supporting most of his weight. The journey to the main gate took 5 minutes that felt like 5 hours. Bennett drifted in and out of consciousness, aware only of movement, gunfire in the distance, and Callahan's steady stream of reassurance. "Stay with me, buddy. Almost there. You're going home. Just hold on a little longer." Outside the gate, the scene looked like organized chaos. American Rangers were loading prisoners onto carts pulled by Filipino guerrillas. Medics moved among the rescued prisoners, conducting rapid triage and applying emergency treatment. And in the center of all, illuminated by flashlights and moonlight, sat something Bennett couldn't quite process: a full medical station with equipment, supplies, and what appeared to be actual doctors. Callahan delivered Bennett to a medic who looked impossibly young and impossibly clean compared to the filth-covered prisoners. Severe leg infection, probably 8 months old. He's been without treatment the whole time. "Can you help him?" The medic, his name tag read Thompson, examined Bennett's wound with practiced efficiency. "Jesus, this should have killed you already. You're one tough son of a bitch." He looked up at Callahan. "Get him to Dr. Martinez immediately. This needs surgical intervention, probably amputation given how far the infection has spread." Amputation. The word should have terrified Bennett, but he felt only numb acceptance. Losing the leg was better than dying from the infection. At least he might survive to see home, even if he'd be a cripple. He was carried to where a woman in army fatigues was working under a portable surgical light, treating another prisoner's compound fracture. Captain Elena Martinez, M.D., was 31 years old and had been a surgeon for 6 years before the Army drafted her medical skills into service. She'd treated battlefield casualties from Guadalcanal to Leyte, but nothing had prepared her for what she was seeing at Cabanat 1. These men weren't fresh combat injuries. They were chronic medical disasters, walking collections of untreated diseases and injuries that had festered for years. She finished setting the fracture, instructed her assistant on bandaging, then turned to Bennett. One look at his leg told her everything she needed to know about the medical care these prisoners had received under Japanese custody. "How long has this wound been infected?" she asked, her voice professional but not unkind. 8 months, Bennett replied, his British accent thick with pain and exhaustion. "Got it from barbed wire while on work detail." Japanese doctor looked at it, said there was no medicine, told me to keep it clean, but there's no clean water, no soap, no bandages. It just kept getting worse. Martinez nodded, already making decisions. "The infection has spread extensively, but I don't think we need to amputate. I've got sulfa drugs and penicillin, real antibiotics, not the counterfeit garbage the Japanese use. I can clean this wound, remove the necrotic tissue, and start you on aggressive antibiotic therapy. You'll keep the leg." Bennett stared at her, unable to process what he was hearing. "Doctor, you don't understand. This infection has been killing me for months. The maggots are probably the only reason I'm still alive. They've been eating the dead flesh. There's no way to save the leg. I've accepted that." "Corporal, I understand better than you think," Martinez replied, already preparing instruments. "I'm looking at what should be a fatal infection in a severely malnourished patient with compromised immune system. Under normal circumstances, you'd be right. This leg will be unsavable. But you Americans brought something the Japanese don't have and don't believe in: modern antibiotics and proper surgical technique. Now, I'm going to give you a local anesthetic. Clean this wound and start treatment. It's going to hurt like hell despite the anesthetic, but you're going to keep your leg." The local anesthetic took effect within minutes, numbing Bennett's leg enough that Martinez could begin the debridement process. He watched, detached by shock and medication, as she used surgical instruments to remove dead and infected tissue. The smell was horrific, rotting flesh and infection that had been festering for 8 months. Medical assistants worked around her, passing instruments, adjusting lights, documenting the procedure as if this were a hospital operating room rather than a hastily established field station outside a liberated prison camp. "You're bringing doctors," Bennett said, the word slurred by exhaustion and pain medication. "You actually brought doctors. Real doctors with real equipment. I thought medics maybe. Field first aid. But this is surgery. You're doing surgery in the middle of a rescue operation." Martinez didn't look up from her work, concentrating on removing a particularly large section of necrotic tissue. The 6th Rangers don't do anything halfway. When they planned this rescue, they knew they'd be extracting prisoners who had been without medical care for years. So they brought a full medical support team: surgeons, nurses, medics, pharmacists, even a dentist. "We've got enough supplies to establish a field hospital for 500 patients. You're number 47, getting treatment tonight." Another British prisoner, Sergeant Thomas Crawford, was being treated at the adjacent station for severe malnutrition and beriberi. He had been watching Martinez work on Bennett with growing disbelief. "Doctor, I don't mean to question your priorities, but shouldn't you be treating the ones who can be saved quickly and moving on? We were always told in the British Army that battlefield medicine means saving the most men possible, not spending hours on difficult cases." Martinez paused her work long enough to look at Crawford directly. "Sergeant, I appreciate British military medical doctrine, but this isn't a battlefield with limited resources and overwhelming casualties. We came here specifically to rescue you. Every man we rescue is a success. I'm not going to let this soldier die or lose his leg, because treating him takes longer than treating someone else. We've got time, we've got supplies, and we've got enough medical personnel to treat everyone who needs treatment." The concept was so foreign to the British prisoners that many simply couldn't accept it. They had spent 2 years watching men die from treatable conditions because the Japanese had no medicine and no interest in treating prisoners. Even before capture, British military medical care had operated on triage principles that prioritized speed and numbers over individual care. The American approach, treating every patient as thoroughly as necessary regardless of time or resource constraints, seemed impossible, almost wasteful. Crawford spoke again, his voice carrying the weight of 2 years watching friends die. "We had a man die last month from an infected tooth. Just a tooth infection. Something that should have been trivial. The Japanese doctor refused to treat it. Said, We should pull the tooth ourselves if it bothered us. The infection spread to his jaw, then his blood. He was dead within 3 weeks. A tooth infection killed him because nobody would provide basic medical care. Martinez's hands paused in their work, and her expression hardened. That's criminally negligent medical care, Sergeant. That's a war crime. And it's exactly why we brought a dentist on this operation. After I finish with Corporal Bennett, I want you to get checked by our dental officer. Anyone with tooth problems gets treatment tonight. Nobody dies from tooth infections on my watch. The medical operation continued to the night as Rangers established a defensive perimeter and Filipino guerrillas transported prisoners away from the camp. The medical station became the center of activity, with doctors and nurses working under portable lights to treat conditions that range from simple malnutrition to life-threatening infections and injuries. Each treatment seemed to astound the British prisoners more than the last. One doctor was performing blood transfusions using whole blood that had been carried in portable refrigeration units. Another was setting complex fractures with proper casts and metal pins. A nurse was distributing vitamin supplements and anti-malarial medication to every rescued prisoner. A pharmacist was dispensing medications from a portable pharmacy that contained more drugs than the Japanese had provided to the entire camp in 2 years. Private James Whitley watched the dental officer extract his abscessed tooth using proper anesthesia and sterilize instruments. The Japanese had told him to stop complaining about the tooth or they would beat him. Now an American dentist was treating the infection, prescribing antibiotics, and explaining how to care for the extraction site. Whitley kept touching his face, unable to believe the pain was actually gone. "This is what we've been missing," Whitley said to Crawford as they sat recovering from their respective treatments. Not just the medicine, but the entire philosophy. The Japanese treated us like we weren't worth the cost of medicine. The Americans treat us like every life is worth whatever it costs to save it. That's the difference between the two sides. Martinez finished Bennett's wound debridement and began the process of packing the clean wound with antibiotic-impregnated gauze. "Corporal, I'm going to be honest with you. The infection is worse than I'd like, and you're severely malnourished, which will slow healing. But I've seen men recover from worse. The sulfa drugs and penicillin will fight the infection. Clean dressings changed daily will prevent reinfection. Proper nutrition will help your body heal. You'll need months of recovery and probably several more surgical procedures to fully repair the damage. But you're going to keep your leg, and you're going to walk again." Bennett felt tears running down his face, though he couldn't pinpoint exactly why he was crying. Relief, certainly. Gratitude, absolutely. But also something like grief for all the men who had died from treatable conditions because nobody had brought doctors, antibiotics, or the fundamental belief that their lives were worth saving. "Thank you," he managed to say, his voice breaking. "I'd given up. I was just waiting to die. And now you're telling me I'll walk again. I don't know how to process that." Martinez squeezed his shoulder gently. "You process it by surviving, recovering, and going home to tell people what happened here. Someone needs to document the medical neglect these prisoners suffered. War crimes don't just happen on battlefields. They happen in prison camps where doctors refuse to treat dying men. Your survival is testimony to that crime and proof that it doesn't have to be that way." By 2 o'clock hours, the last prisoners had been extracted from Covenant 1, and the convoy began its dangerous journey back to American lines. The mobile hospital moved with them, doctors and nurses continuing to provide care during the evacuation. Bennett rode in an ambulance cart, his leg properly bandaged for the first time in 8 months, antibiotics flowing through his system, hope replacing despair. The evacuation convoy reached American lines at dawn after a harrowing 20-kilometer journey through Japanese-held territory. The rescued prisoners were immediately transferred to a fully equipped field hospital that had been established in anticipation of their arrival. What the British prisoners saw there exceeded even the mobile medical station that had amazed them the night before. The field hospital occupied a cluster of buildings that had been a school before the war. American medical personnel had transformed it into a functioning hospital with operating rooms, recovery wards, pharmacy, laboratory, X-ray equipment, and even a small blood bank. Generators provided electricity for lights and medical equipment. A water purification system ensured clean water for drinking and sterilization. Supply trucks arrived hourly with fresh materials, food, and medications. Corporal Bennett was carried into the surgical ward where Dr. Martinez would perform a more thorough procedure on his leg now that she had proper facilities. An anesthesiologist explained that he would be given general anesthesia for the surgery, that he would sleep through the procedure and wake up afterward with no memory of the operation. Bennett had never heard of such a thing. During his previous surgeries before the war, he had been given whiskey to dull the pain and told to bite on a leather strap. "You're going to put me completely to sleep?" Bennett asked, uncertain he had understood correctly. "That's safe? I'll wake up afterward." The anesthesiologist, a calm man named Captain Robertson, smiled reassuringly. "Corporal, I've administered anesthesia for over 300 surgeries. It's completely routine and very safe when done properly. You'll breathe in some gas, count backward from 10, and wake up a few hours later with your surgery completed. No pain, no awareness, just sleep." The concept seemed like something from a science fiction story. Bennett had watched men undergo amputations in the prison camp, screaming and thrashing while other prisoners held them down. He had seen the Japanese perform surgeries without any pain relief at all, treating prisoners' screams as background noise. Now he was being told he would simply sleep through his surgery as if it were a normal night's rest. Sergeant Crawford and several other prisoners were gathered in a recovery ward where nurses were conducting comprehensive medical assessments. Each prisoner was being weighed, measured, examined, and evaluated for every possible medical condition. Blood samples were taken for laboratory analysis. Chest x-rays checked for tuberculosis. Stool samples were tested for parasites. The thoroughness was overwhelming. A nurse named Lieutenant Sarah Morrison was documenting Crawford's medical history and current conditions. She worked through a standardized checklist, asking about symptoms, previous injuries, diseases, and treatments received during captivity. Her efficiency and competence were remarkable, but what struck Crawford most was her attitude. She treated every prisoner as if they were American soldiers deserving of the best possible care, not foreign nationals or burdens on American medical resources. "Sergeant, I'm seeing signs of beriberi, scurvy, anemia, and possible tuberculosis," Morrison reported after completing her examination. "You're also severely malnourished and dehydrated. We're going to start you on vitamin supplementation immediately, including high doses of thiamine for the beriberi and vitamin C for the scurvy. You'll receive daily vitamin injections for the next week, then transition to oral supplements. We're also starting you on an iron supplement for the anemia and scheduling a follow-up chest x-ray to evaluate your lungs." Crawford listened to the treatment plan with something approaching disbelief. "All of that for me? I'm not dying, just malnourished. Surely there are more critical cases that deserve your attention and medications." Morrison's expression became serious. "Sergeant Crawford, I need you to understand something. You are a critical case. Severe malnutrition, combined with multiple vitamin deficiencies, is life-threatening. The beriberi can cause heart failure. The scurvy can lead to internal bleeding. The anemia means your body isn't getting enough oxygen. Left untreated, any one of these conditions could kill you within months. You're getting comprehensive treatment because that's what you need to survive." The philosophical gap between British and American medical approaches continued to manifest throughout the day. British prisoners kept apologizing for taking up doctors' time, for acquiring medications, for needing treatments they believed they didn't deserve. American medical personnel kept insisting that treating them wasn't a burden or a favor, but simply their job, what they had come to do, what every patient deserved. Private Whitley was in the dental clinic, receiving follow-up care for his extracted tooth. The American dentist, Major David Fisher, was examining Whitley's entire mouth and documenting extensive dental damage caused by malnutrition and lack of care. "You got 7 more teeth that need extraction or repair," Fisher reported. "The malnutrition has caused severe gum disease, and several teeth have infections that will cause serious problems if not addressed. I'm scheduling you for a comprehensive dental restoration over the next 3 weeks." Whitley shook his head. "Major, I appreciate the extraction yesterday, but I can't possibly impose on you for 3 weeks of dental work. That's too much. Just pull the teeth that are causing immediate problems, and I'll manage with the rest." Fisher looked genuinely puzzled by the response. "Private, this isn't imposition. This is dentistry. Your teeth are damaged and infected. I'm a dentist. Fixing damaged and infected teeth is literally what I do. Why would I do anything less than comprehensive treatment? You're going to need proper dental function to eat the high-nutrition diet we're prescribing for your recovery. Bad teeth mean you can't eat properly, which means you can't recover properly. It all connects." The conversation was interrupted by commotion from the surgical ward. Dr. Martinez had completed Bennett's surgery, and he was being transferred to recovery. The operation had taken 4 hours, far longer than Bennett had expected to survive under anesthesia. He woke slowly, confused by the absence of pain, uncertain where he was or what had happened. Martinez was there when his eyes focused, checking his vital signs and examining his responses. "Welcome back, Corporal. Surgery went well. I removed all the infected tissue, cleaned out the wound cavity, and left drainage tubes to prevent fluid buildup. You're going to stay in recovery for 3 days minimum while we monitor for a post-surgical infection. Then you'll move to the rehabilitation ward where physical therapists will help you regain strength in that leg." Bennett's mind caught on a phrase that didn't make sense. Physical therapists? What's a physical therapist? Specialists who help patients recover mobility and strength after injuries or surgery, Martinez explained. They'll work with you daily, teaching you exercises to rebuild muscle, helping you relearn how to walk properly on that leg. It's going to be hard work, and it's going to hurt, but it's the difference between walking normally and limping for the rest of your life. We've got 2 physical therapists assigned to work with rescued prisoners who need rehabilitation. The resources being devoted to the rescued prisoners seemed limitless. Not just doctors and nurses, but specialists of every kind. Not just emergency treatment, but comprehensive long-term care plans. Not just saving lives, but optimizing recovery and long-term health outcomes. The Americans weren't just rescuing prisoners. They were rebuilding them. That afternoon, a delegation of American medical officers met with a senior British officer among the rescued prisoners, Major Jeffrey Hammond. The Americans wanted to discuss medical documentation of the conditions the prisoners had endured and the treatment deficiencies under Japanese captivity. They were building a case for war crimes prosecution and needed detailed testimony. Major Hammond sat across from Colonel Richard Patterson, the chief medical officer for the Theater Command. "Colonel, I'm prepared to provide whatever testimony you need. The medical neglect we suffered was systematic and deliberate. Men died from treatable conditions because the Japanese refused to provide even basic medical care. But I have to ask, why are you devoting this level of resources to treating us? We're British troops, not American. Your obligations under military alliance don't require this level of comprehensive care." Patterson's response was immediate and firm. "Major, we're devoting these resources because you're human beings who were systematically tortured through medical neglect. The fact that you're asking why we're treating you reveals how deeply the Japanese degraded your sense of worth. You don't need to be American to deserve medical care. You need to be sick or injured. That's the only qualification required." Over the following weeks, the rescued prisoners remained at the American Field Hospital, receiving treatment that continued to astound them. The facility operated with a level of organization and resource allocation that seemed almost extravagant compared to what the British prisoners had experienced in their own military medical system, let alone during Japanese captivity. Corporal Bennett's recovery became a case study in comprehensive rehabilitation. Dr. Martinez supervised his care personally, coordinating between surgeons, infectious disease specialists, nutritionists, and physical therapists. The infected wound that should have killed him was healing cleanly under aggressive antibiotic therapy. His weight increased steadily as American cooks prepared high-calorie, high-protein meals designed specifically for recovering prisoners. The physical therapy sessions were brutal. A sergeant named Tommy Rodriguez worked with Bennett daily, pushing him to exercise muscles that had atrophied during months of infection and immobility. "I know it hurts," Rodriguez would say during particularly difficult sessions. "But pain means healing. Pain means your body is rebuilding itself. No pain means you're not working hard enough to recover." Bennett had never encountered the concept of physical therapy before. In British military medicine, soldiers recovered from injuries or they didn't. There was no systematic program to optimize recovery. Now, he was learning that recovery wasn't passive, that it required active work, and that proper rehabilitation could mean the difference between disability and full function. The Americans think about medicine differently than we do, Bennett told Sergeant Crawford during one of their conversations in the recovery ward. We British treat medicine as repairing damage. You get injured, a doctor fixes you if possible, and then you're on your own to recover. The Americans treat medicine as a complete process from injury through full recovery. They don't consider treatment finished until you're back to full function. Crawford nodded, having observed the same pattern. His beriberi was responding to vitamin therapy, but the American doctors weren't satisfied with just eliminating the disease symptoms. They were monitoring his heart function, adjusting his diet to prevent recurrence, teaching him about nutrition science, and planning follow-up care that would continue for months after he left the hospital. The comprehensiveness was overwhelming. The psychological impact of the American medical care was as significant as the physical treatment. Prisoners who had spent years being told they were worthless, that their lives didn't matter, that their suffering was unimportant, were now being treated as if they were the most important patients in the world. Nurses learned their names and remembered details about their lives. Doctors spent time answering questions rather than rushing through examinations. The simple dignity of being treated as human beings worthy of care was healing wounds that had nothing to do with physical injuries. Private Whitley completed his dental restoration after 3 weeks of treatment. Major Fisher had extracted 7 teeth, filled numerous cavities, treated his gum disease, and fitted him with partial dentures for the missing teeth. The work had been meticulous and thorough, far beyond what Whitley had expected or believed he deserved. "You've given me back my smile," Whitley told Fisher during the final appointment. "I know that sounds melodramatic, but it's true. For 2 years, I was ashamed to smile because my teeth were rotting. I stopped smiling altogether. Now I can smile again without embarrassment. That's worth more than you can imagine." Fisher smiled in return. "Private, that's exactly why I became a dentist. Oral health affects everything: nutrition, speech, self-confidence, social interaction. Fixing teeth isn't vanity medicine. It's restoration of function and dignity. I'm glad we could help." By the 6th week, most of the rescued prisoners had recovered enough to be considered for transport to Australia and eventual repatriation to Britain. The American medical staff conducted final evaluations, ensuring each man was stable enough for travel. Those requiring ongoing treatment would remain at the field hospital until they were ready. Major Hammond organized a formal thank you ceremony, bringing together the rescued British prisoners and the American medical personnel who had treated them. Hammond's speech was emotional and heartfelt, his voice breaking several times as he tried to express gratitude for care that exceeded anything the prisoners had imagined possible. "When the Rangers liberated us, we expected rescue," Hammond began. "We hoped for basic first aid, perhaps some food and water, then transport to safety. What you provided was so far beyond that expectation that we still struggle to comprehend it. You brought doctors, real doctors with real equipment. You brought surgeons who performed complex operations in field conditions. You brought specialists of every kind. You devoted resources to our care that seemed and still seem impossibly generous." He paused, looking around at the British prisoners who had survived because of American medical intervention. "You saved men we thought were unsavable. You treated conditions we believed were untreatable. You gave us back not just our lives, but our futures, the ability to walk, to eat, to function as complete human beings rather than damaged survivors. We came here as barely living skeletons. You're sending us home as men who have a chance at normal lives." Colonel Patterson responded on behalf of the American medical staff. "Major, we did what any decent medical system should do. We treated sick and injured people to the best of our ability. The fact that you find this remarkable, that you feel exceeded expectations, says more about what you endured under Japanese captivity than about what we provided. This is just medicine done properly. This is the standard of care that every human being deserves." The philosophical difference remained even at the end. The British prisoners viewed the American medical care as extraordinary generosity, exceeding any reasonable expectation. The American medical personnel viewed it as simply doing their jobs to an appropriate standard. Neither side could fully understand the other's perspective because they came from fundamentally different assumptions about what medical care should be. Corporal Bennett was among the last to leave the field hospital, his recovery having required additional surgical procedures to fully repair his leg. On his final day, Dr. Martinez conducted a last examination and officially declared him fit for travel. "Your leg will never be exactly what it was before the infection," Martinez told him honestly. "You'll probably have some lingering stiffness, possibly some pain during cold weather or after extensive walking. But you're going to walk normally, you're going to have full function, and you're not going to lose a leg. That's about the best outcome we could have hoped for given how bad the infection was." Bennett looked at his leg, at the scars from multiple surgeries, at the muscles that had rebuilt themselves through months of physical therapy. "Doctor, 8 months ago, I was waiting to die from this infection. 3 months ago, I expected to lose a leg. Now you're telling me I'll walk normally with only minor long-term effects. That's not the best outcome we could have hoped for. That's a miracle." Martinez shook her head gently. "Not a miracle, Corporal. Science, medicine, antibiotics, surgery, nutrition, and rehabilitation. We didn't pray your infection away. We treated it systematically using proven medical techniques. The miracle isn't what we did. The miracle is that the Japanese had access to these same techniques and chose not to use them. That's the crime that deserves recognition." The transport to Australia departed on a clear morning, carrying 83 British prisoners whose lives had been saved by American medical intervention. They carried with them comprehensive medical records documenting their conditions at liberation and the treatments they had received. These records would eventually become evidence in war crimes trials, proof of systematic medical neglect by Japanese forces. As the ship pulled away from the dock, Bennett stood at the rail with Crawford and Whitley, watching the American field hospital disappear in the distance. They had spent 2 months receiving medical care that exceeded anything they had experienced before the war, let alone during captivity. "We're going to have trouble explaining this when we get home," Crawford observed. "How do we describe to people who weren't there what American medicine is like? How do we explain that we received better medical care from allies we barely knew than we would have received from our own government under normal circumstances?" Bennett considered the question carefully. "We tell the truth. We tell them about Dr. Martinez performing surgery in the middle of a rescue operation. We tell them about nurses who treated us like we mattered. We tell them about specialists who devoted weeks to our recovery when they could have simply stabilized us and moved on. We tell them that the Americans don't just fight wars. They fight wars while simultaneously treating everyone as if they're worth saving." The rescued prisoners reached Australia 2 weeks later and began the final phase of their journey home. British military authorities interviewed them about their experiences, documented their ordeals, and prepared them for repatriation. But many of the prisoners found themselves struggling to articulate what the American medical care had meant. It wasn't just that their lives had been saved. That was important but straightforward. It was that they had been treated as if their lives were worth the cost of saving them. After years of being told they were worthless, of watching friends die from treatable conditions, of accepting that survival was a matter of luck rather than entitlement, the American medical system had told them something different. It had told them they mattered. That message, delivered through antibiotics and surgery and physical therapy, was the real healing. Years later, Bennett would tell his grandchildren about the infected leg that should have killed him and the American doctor who refused to let him die. He would show them the scars from multiple surgeries and explain how each one represented a choice by American medical personnel to invest time and resources in saving a British soldier they had no obligation to save. They brought doctors, he would say, still amazed decades later. In the middle of a combat operation behind enemy lines, surrounded by Japanese forces, with every reason to prioritize speed over care, they brought doctors, real doctors with real equipment who treated us like we were their own soldiers. That's what separated the Americans from everyone else. They didn't just fight to win, they fought to save. Medical care in war reveals more about a nation's character than its combat effectiveness. The Americans who brought doctors, antibiotics, and comprehensive care to liberated prisoners weren't making a strategic calculation. They were expressing a fundamental belief that every life is worth saving. If stories about the humanity that persists even in warfare resonate with you, subscribe to our channel for more forgotten moments when people chose compassion over convenience and healing over expedience.